fear, worry, and anxiety. Not only about contracting the virus specifically, or the fact that you can't see your friends or your family in the flesh, but also just worrying about job loss, finances, and the uncertainty of the future. We thought it would be great to provide a forum where you can learn more about anxiety, as well as some strategies you can use to manage your mood during this time. We're happy and very privileged to have as our speaker today, Dr. David Gold. Dr. Gold is a neuropsychologist at the Toronto Western Hospital, where he works primarily with pre- and post-surgical epilepsy patients, especially in the area of memory and cognition. He's also an assistant professor at the University of Toronto's Department of Psychiatry. Dr. Gold runs a small private practice where he sees clients for psychotherapy, and he's very skilled in the managing patients with anxiety, depression, and other mood disorders. So what better person to share with us today on managing anxiety. Just a few housekeeping. After Dr. Gold's presentation, we will be having a time for questions. So feel free to type your questions into the comments or chat section of this page, and we will try to go through them after. We will do our best to answer as many questions as we can. Just a few reminders: when posting questions, please refrain from sharing any personal health information or asking questions very specific to your health condition or your treatment regimen, as these are best answered by your healthcare team. Please note that the session will be recorded and will be accessible right here on our Facebook page or on Epilepsy Toronto's YouTube channel within a couple of days. So, Dr. Gold, over to you.
Okay, great. Thank you, Rosie. I appreciate the introduction. And so it's a great time now to be talking about what are our strategies for anxiety, because if you're not anxious before, then now's a really good time to start being anxious, because our world's in a different shape and it's a scarier place. And so we need tools to help us self-soothe and feel okay. So when I thought about this talk, I thought, okay, what are some strategies that I can give people in order to talk about what's going on in terms of fear, anxiety, and worry? And so a really good place to start is just defining what those terms are and how we can use them and understand them. And so we'll go through definitions of what is fear, what is anxiety, and what is worry. And once we know what those different emotions are or states of being, we can also talk about how we can meet those emotions either skillfully, which is what we want to be promoting, or avoidantly, which would be signs that we're not dealing with those emotions well. And so we're going to also talk about strategies to manage fear skillfully by accepting it. And it sounds counterintuitive because usually we want to run away from fear, but we're going to think about an approach in which we actually manage fear by accepting it. And so we'll talk a little bit about that. And the other thing we're going to talk about are what are some strategies to look at thoughts about worry. And so one example of that could be what we call cognitive restructuring or balancing thoughts. So we'll do a crash course in managing worries from a thinking perspective. So beginning with our definitions, one of the first places to start is what is fear. And so fear is not a bad thing. It's actually pretty healthy, and it's an emotional state, and it's a response to a direct threat. And the way to remember what fear is to try to think about fight or flight. So if there were a tiger chasing after us, that is the same type of mechanism that would help us run away or crawl up into a little ball, whatever the best response would be. But it's pumping blood to our hearts, it's increasing our body temperature, it's making our neck tighten up so that our neck is less likely to be injured by that tiger. And so it's a series of responses that are directly intended to protect us from threat. And so our fear system is actually a very important system. We have to go from hating it to saying, thank you, you're a good system. You're going to save me from that tiger chasing after me in the Serengeti. And so our fear response is intended to activate us, get us engaged, and prepare us for either fighting or getting away from that tiger. Anxiety is something a little bit different, and it's actually a state related to the possibility of threat. So our brains have evolved such that we can actually think about what is threat, what seems like it's going to be trouble for me, what is problematic. And it's actually an experience we mostly think about in our body. And so anxiety is this state after we're done with fear that's related to the possibility of trouble. And we feel it in our body. And so some examples of anxious feelings could be feeling tired, feeling like your muscles are tight after that initial surge of adrenaline to protect you, feeling lightheaded, feeling sensations in your tummy. Those are all examples of prolonged states of anxiety. And worry is something that's even more evolved, and that's something we do that are thoughts, and it's related to the idea of fear or anxiety. So a worry is a thought that we do to try to distract us from that feeling of fear or anxiety. So we'll talk a little bit about what fear and anxiety thoughts are, but just as a preview, they always, in my experience, carry the form of what if. So what if this COVID doesn't go away? What if my boss fires me? What if I'm not prepared? What if I look funny? What if I can't think of what to say? So worry has a particular architecture, and we're going to train ourselves on being aware of what that architecture is. So when we think about fear, we don't have many lions and tigers in our lives anymore, and instead we have ideas and principles. And so one of the examples of something that triggers fear is a situation that is uncertain or unclear. And so if you can think about our current example, we're listening on the news that, whether we should or should not engage in certain actions, what we should do is changed, whether we should take the TTC, what sort of medications are appropriate. All sorts of things are changing in response to the current situation of COVID. And no wonder we're feeling afraid, because things are uncertain or unclear. And so that is a trigger for fear. And just knowing that is an important situation. And so if you get a call and someone tells you to expect something, but you're not sure what to expect, that might introduce fear for you, because you're not sure, because the situation is unclear or uncertain. So things that are new or things that aren't well defined are actually quite frightful for us. The other way that we can make ourselves feel afraid is by overestimating a threat and underestimating ourselves. So an example of this could be if you're feeling very afraid right now that you're somehow going to be contaminated with COVID. So if you overestimate the likelihood of you being contaminated and underestimating your own ability to defend against it, such as social distancing or physical distancing, as we're calling it now, or washing your hands, or general good self-care, you overestimate the threat and it feels scarier, and you underestimate ourselves, which makes us feel fear because the threat is bigger than our own capacity to cope with it. And so one thing to remember is this is a lot like the weather with probabilities. And so if we overestimate the probability of something bad happening and we underestimate ourselves, that is one way we can certainly feel afraid. So what do we do when we're afraid? Well, we've got choices. And in this world of emojis, I've reverted to just simply using symbols, and check mark for adaptive. And so under adaptive, in really tiny words, it says coping. And under maladaptive, we have avoiding, numbing, or anger. So we can actually
just
know.
want to let you know that we're not seeing your screen. If you want to share your screen,
Oh,
you can do that by going to the bottom of your screen, share screen.
sorry.
No worries. These are little technical glitches in live entertainment and live counseling. So at the bottom of your screen, there's a green button saying share screen. Do you see that? Sorry, folks, we're just going to sort this out so you can see what he's talking about. There we go.
Sorry about particular emotional state. And we wanted to juxtapose that with anxiety, which is some sort of threat in response to the possibility of fear. And worry is one of those thoughts. And the next thing I asked everyone to consider was, what triggers fear? And so we have uncertain things or unclear things, and those make us feel afraid. And also when we overestimate the threat or underestimate ourselves. That's another example of something that can make us feel afraid. And so the next thing I was going to jump to was, what do we do with that fear? So how do we manage that fear? And so our options are to cope with it adaptively. And an example of adaptive coping for fear could be some sort of skill or strategy. And we'll talk about what those skills or strategies are. And an example of a maladaptive approach would be either avoiding that emotion, numbing ourselves with either drugs or alcohol or some sort of activity, or anger and lashing out at other people. And so we can also learn from our response to fear what is currently going on with us. And so when we're coping adaptively, we kind of imagine ourselves having a toolbox and pulling out a particular tool to say, wow, I'm feeling afraid. What can I do in response to that fear? Whereas maladaptive coping could be, I can't deal with how afraid I am right now. I'm just going to watch some Netflix. Or I'm so afraid right now, I'm just going to start eating every piece of junk food in my house. Those are examples of avoiding, numbing, or some sort of anger response in response to fear. And so in its place, we can actually approach fear more skillfully. And this applies to fear or even other difficult emotions for us. And so another example of how we can just be with that is what I call a mindful approach to emotion. And this is a system that looks at regulating emotion instead of trying to avoid it. And so the first step is to just simply notice, what sensations do I feel in my body? And so this is kind of like a mindful body scan for those who are familiar with mindfulness. And it's just looking inside your body and saying, what do I feel? And once you are able to address what you feel, give it a name. And so I use the expression, if you name it, you can tame it. And so when you tell a kid that it's just a noise in the closet, it's not a monster, they start to be able to name it that, oh, it's just a noise. I'm not afraid of it anymore. And so we can label our own emotion. We can say, okay, I feel some tightness in my chest, and I feel some warmth, and I'm going to call this feeling being tense. I feel this tension in my chest. I feel some dryness in my mouth, and I'm going to call this my tension fearful response. And the next step we're going to think about is, can you accept this emotion? And so we're going to spend some extra time talking about how we allow that emotion, because there's a particular skill or approach there that's important to address. Once we figure out how to be with that emotion, we can actually do a little bit of detective work and say, what is this emotion trying to tell me? What do I need? And so we're going to focus on how to skillfully address those different emotions. So focusing on that step 3 of you've addressed something in your body, you know it's there, you've labeled it, and now how do you allow it to be there? And so this is kind of the opposite of what we do with difficult emotions sometimes, which is try and run away, try and make it go away. But what I'm going to ask you to do for this exercise is to simply be with that difficult emotion. And so radical acceptance asks us to just be with the emotion, or not try to fight it, not try to run away with it, even if we don't like it. So you might say to yourself, I'm in pain right now. I want this pain to go away. I'm going to do whatever I can to avoid pain. I'm in fear. I want to run away from this fear. I hate this fear. I want it to go away. And what I'm saying is actually the opposite. If you can accept that fear and just be with it, that fear will rise, plateau, and descend. So if you look at the little chart on the bottom, that's a plot of emotion over time. And what we know about any emotion is that it rises, it goes up and gets higher and higher, and then it reaches a level where it can't go any higher, and then it starts to decline. And so that's an important piece of information for us, because as we tolerate it, that emotion, it changes and it becomes less intense. And so one of our challenges is to simply be with an emotion as it's difficult, knowing that it'll get less and less difficult over time. And so that's what radical acceptance asks us to do. And so during that time where we're just allowing an emotion and we're not doing anything else, one thing we can do is we can be mindful. So we can have some sort of intentionality to our action, knowing that we are approaching this problem of fear skillfully and saying, You're allowed to be here right now. Another analogy I like to do is that of a hotel guest operator. And so, if you imagine this clerk at a hotel, they might have some cranky people making a lot of noise, partying very loudly. And that hotel clerk can go in and try to discipline those people and be very upset about it. Or they can say, you know what, for tonight, they're going to be noisy and rowdy, and I'm going to get a bad review if I'm rude to them. So I'm just going to accept that these unpleasant house guests are here right now. And so in the analogy, the unpleasant house guests are like fear or pain or some sort of other difficult emotion that we're trying to run away from. So one thing we can do that's more mindful is to say, okay, I'm in pain right now. I feel this fear. I feel this sadness. What can I do? Can I soften it? And so I imagine my chest now that's tight from that tense feeling I told you about before, that I need to soften it. So I can imagine softening it. And I can imagine soothing it as well with a self-compassionate approach, saying, I'm sorry, Dave, this is really hard right now. I'm sorry you're in pain. I'm sorry you're feeling that tension in your chest. Can I just allow it to be there? And when it's done, it will leave. Okay, that helps me feel a little bit more grounded. Another example of a mindful activity could be a guided meditation where you're focusing on visualization, you're focusing on mindfulness of breath. Any way of just being with the emotion is allowing it to be there without avoiding it or saying it's not there. And so counterintuitively, what we're going to do with fear and other emotions is just try to accept it. And if we can accept it, we can avoid that step where we go into anxious thoughts and worried thoughts. And so focusing back now on step 4 and 5, we've talked about how we notice the emotion, we label it, and we allow it to be there mindfully. We can then ask ourselves, what need is there? What emotion is this telling me? So if I'm in pain, maybe I need some sort of soothing. If I'm in sadness, I need some sort of comfort. If I'm feeling fearful, I need some sort of security. And so if we just ask ourselves, what is this emotion telling me that I need? We can choose certain activities that are either activating or soothing. So an example of an activating activity would be if you addressed that you're feeling some loneliness or some sadness. Maybe you need to activate with exercise or calling a friend or playing a game or doing some sort of activating activity. Whereas other times you might feel like, wow, this feels so hard to handle. It's really intense and I'm feeling very agitated. I need soothing. An example of a soothing activity could be listening to music, could be taking a bath, any sort of activity that brings down your central nervous system activity. And so we can be skillful, and I imagine ourselves just like a very good plumber picking the right tool that that plumber needs in order to perform the action. There's not one tool for every job. Instead, we need to pick the tool that our need is telling us. And so once we address that need, we can skillfully match it with that particular action. And in the background, the way to kind of foster that or create the really nice environment for it is to be self-compassionate with ourselves. And so an example of that could be apologizing to ourselves and saying, like, I'm sorry this is hard right now, or this situation is really frustrating and no wonder this is difficult. Can you be kind to yourself that this is hard right now? And so self-compassion is a skill just like any other skill where we can practice being self-compassionate while still having high standards and being rigorous and motivated. It doesn't mean letting go of our standards. It means just being kind to ourselves as we're going through a difficult emotion. So where are we now? Well, we've talked about emotion and how we can meet it skillfully and compassionately in order to make adaptive choices. So when we're coping, we're saying, okay, this difficult emotion is here. Can I be kind to myself? Can I give myself what I need? Either just with a mindful activity or simply selecting an activity that's either soothing or activating. But that doesn't leave us with tools for these worried thoughts that we're having. And so what we'll talk about now is how to manage some of those worried thoughts. And so worry, as I mentioned before, is the thing that we do in response to things that are uncertain or unclear. So if I have a thought and the reason that thought came up is because I'm not sure what's going to happen next and things are uncertain or unclear. So an example could be, what if I can't get enough food? What if What if I don't have a job? Those are all examples of worried thoughts. And what worried thoughts are a way of distracting ourselves from fear. And they're questions that can't get answered because they're unanswerable. They're about the future. And so one of the easiest things to do when we notice a worried thought is to say, not allowed to do that right now. That's a worried thought. So if we have awareness for it, we can say that type of thought right now is actually not a beneficial type of problem solving. Instead, we can replace it with a problem solving approach. And so an example of a problem solving approach could be a pros and cons list, some sort of plan to say, this is the current problem, and this step or that step will help me get me closer to my goal. And so current problems can actually be solved with some sort of strategy instead of some sort of worry type behavior that actually prevents us from dealing with the problem. So once we start to worry, we usually worry about something else and it becomes cyclical. And so it's not an effective problem solving approach, and it actually hurts problem solving. So my recommendation once we notice a worry thought is to stop ourselves and to say, how can I approach this with a problem solving approach? Because the what ifs will become, what if this, what if that, what if this, and it becomes cyclical, and it's not an efficient form of problem solving. So when we put all of our strategies for worrying together, we see the very first step I recommend is simply just being aware for that type of thought that you're having that says, what if? And that what if question is one where you can just stay back and say, okay, that's a worry thought. What is the problem here that I can solve strategically? And so that strategy is simply just being aware of what you're doing and disengaging. So kind of like trying not to bite your nails. It's awareness that you're biting your nails and saying, nope, I'm not allowed to do that anymore. The other thing we can do with those what if questions, if they are very, very sticky and we need to answer them, could be asking the other what if. So if you're asking the question, what if I don't have enough food? The other question could be, well, what if I get more food? Another example could be a different what if question could be, what if I'm going to lose my job? Another question, way of meaning that could be simply just saying, well, what if I don't lose my job? So we always focus on our feared thought without actually appreciating the other consequence. So with our what if thoughts, if you have to ask that question, we can also ask the other what if. So what if the fear? And then answering it with, what if the thing I don't fear about? Another strategy is simply to look at the odds. So a lot of people right now are very fearful about COVID, and the truth is we're overestimating our likelihood of being contaminated with COVID. And so when we're practicing physical distancing as much as we can, and safe practices, washing our hands, other sorts of preventative practices, the probability of us getting sick is actually quite low. And so we hear a lot of information in the news and the media about people getting sick, but less than 1% of our population is sick. So one thing we can do to correct that overestimation of the odds is actually to recheck our odds and say, what is the true odds of me getting sick? And the answer is it's very low. So I put 10% in my little example, but the truth is it's much lower than that. And so one thing to focus on then is to say I'm overestimating the odds, and I can feed that back to myself to say, even though I really feel like there's a big chance of me getting sick and I'm really worried about it, and I'm worried about a whole bunch of other things, the true risk is actually much smaller than what I appreciate. The other thinking strategy that we'll go over in a little bit of details is this technique of catching a thought, checking it, and changing it. So let's talk a little bit more about that. And so what we know about our thoughts is that our particular thoughts influence our behaviors and our feelings. So when we're feeling calm, we do calm things and we have calm thoughts. So if you're in an alleyway and you hear a beer bottle crash, you think, whoa, I'm in danger. I'm hearing a beer bottle crash. Whereas if you're at a wedding, you say, oh, a beer bottle crashed. Oh, this is wonderful. And so different situations influence the way we think and feel. And so we need to take advantage of those relationships in order to help change certain thoughts we're having that might not be adaptive. And so what is a non-adaptive thought or a maladaptive thought? Well, when we look at all the people in the world that we've studied and say, what kind of patterns do we know about unhelpful thinking? We've been able to identify that there are 10 or 12 really common ways that people think that we know are not adaptive or helpful. In some ways, they're looking at the world in a way that's going to make them feel worse. So one way to do that is all or nothing thinking. And so that's an example where I'm not going to try it unless I do it really well. And there are no shades of gray. Everything's either right or wrong. And so that person is terrible or that person is great. Another example of a maladaptive type of thought is jumping to conclusions. And so that's an example where we read people's minds or we try to predict the future. And we know that that's not a helpful thing to do, because if we were good at predicting the future, we'd all be wearing a lot fancier clothes. And so another example that I'll just briefly mention is that of magnifying or catastrophizing. So that's where we blow things out of proportion because we're losing touch with how common or uncommon something is. And so when we're making those types of thinking mistakes, one thing we can do is just be aware of it and say, how can I look at the evidence in order to feel a little bit differently about what's happening? So I give you an example here of catching it, checking it, and changing it. So the first thing we do is we start off with the situation and we say, what is the specific episode I'm talking about? Next thing we do is we look at the feeling and say, how did I feel in that situation? And catching it refers to catching the thought. So what thought did I have? And then checking it refers to looking at what evidence do I have to support that thought? And is it beneficial? That's what we're checking. And then changing it refers to what are more accurate or beneficial thoughts for us? And finally, the resulting feeling is checking, was this exercise helpful? How do I feel now? And so if we scroll down a little bit here, we see that an example could be the boss tells me my project idea is bad. And so I'm feeling angry and I'm feeling sad. And I catch that thought. I say, oh, she doesn't value my perspective and I'm feeling angry and sad and I'm not happy about this situation. So I go to my record here, my catch it, check it, change it record, and I say, what evidence do I have to support this thought? Is it helpful to think this way? And so I know that she didn't say that she doesn't value my perspective, and I know that it doesn't help me to think that. And I know that this is generally an unhelpful thinking style that's called mind reading or fortune telling. And so in terms of changing it, I'd say, even though I felt badly she didn't like my project idea, it doesn't mean she doesn't value me as an employee. So I'm focusing on this part of the experience where I'm guessing what she's thinking, and the result of guessing what she's thinking made me feel poorly. And so my resulting feeling once I feel this and replace that thought is actually to feel calmer. And so I give you guys a blank template that I'll be able to circulate towards the end. And the purpose of having that is to be able to do your own thoughts. And so it takes time to practice and get skillful at doing this. But this catch it, check it, change it can actually be a really nice skill to check whether I'm thinking in a way that's helpful for how I'm feeling and how it influences my actions. And so when we think about the things we can control and things we can't control, an important realization is that we feel anxious when we try to control things that we can't control. And so we can control a whole bunch of things right now, but maybe we feel really out of control because we're trying to control other people or other things. And so we may go to the store and find out there's not enough toilet paper. We may find out that the lineups for certain things are too long, or a favorite thing we like to do has been canceled, or we're concerned about other things. And so the way to manage that is to focus back on the things you can control. And so if you try to change something you cannot control, you will feel frustrated and anxious. And so one way to try to balance that or counteract that is to refocus your energy towards things you can control. So can you be active in your house or in a physical distance kind of way? Can you reach out to people? Can you practice gratitude? These are all different types of things you can do at this time where you're feeling like so much is out of your control. And so just to summarize, one thing we can do when we're feeling afraid is, instead of jumping to the part about worrying or feeling anxious, is just tolerate the fear. So just be with the fear and tolerate it. And then once we're with the fear, we can choose some sort of skillful action to help give us comfort, because fear is usually a sign that we need to be comforted in some way. Another thing we can do is we can challenge certain worry thoughts. And so if we have this worry thought of what if, we can disengage. That's one option. Another option we can do is say, well, what if the events that I don't fear? So what if I run out of my favorite drink? Well, what if I don't run out of my favorite drink? What if any sort of fear can be also counterbalanced with what if it doesn't occur, so that we're probability estimating in a little bit more reasonable way. So you could think about the news, or you could think about the weather, and you could be aware that we get a certain probability of events occurring. And so when we overestimate the probability of something occurring and we underestimate our ability to cope, we will feel more afraid. And so we can adjust that by simply looking at the true odds of something happening and appreciating the true threat. And then finally, an important reminder when we're feeling anxious is to say, am I trying to control things that I can't control? And one way that we know we can make ourselves feel more out of control is focusing on things we cannot control. And so my recommendation is to try to focus back on things you can control, which is physical distancing, hand washing, your activities that you do for pleasure, the way you connect with people, the types of activities that you're choosing that can be either activating or soothing. And so I will pass on some readings, because that's just a little introduction to some of these topics like CBT, mindful meditation, self-compassion, and just getting proper information about how to manage COVID in a time where you might be feeling anxious before COVID started, or sad, and how do you manage how you're feeling now. So I provide these websites as just a couple of quick ways of getting information to yourself. And yeah, and so I guess I will pass it on to Rosie.
Wow, thank you so much, Dr. Gold. That was very, very informative. For sure, I'm sure that a lot of us have benefited from all those tools and strategies that you have shared. So now we're just going to go into a time of Q&A, and I encourage those of you who are watching to keep posting your questions, as we will be going through as many of them as we can. So Dr. Gold, one of the first questions that we have is, sometimes anxiety and stress can trigger seizures. I know it's not in my control to not have a seizure, but I'm wondering if you have any advice on what I can do not to have seizures as a result of my anxiety.
Yeah. And so I think the best approach would be to say, I can control the amount of anxiety that I'm experiencing, but I can't control my likelihood of seizure freedom directly. I can only influence this indirect part. So even if you're doing everything perfectly, you're feeling calm, you have a really good mindful practice, well, it's still possible that you could feel anxious. And so to that, I would say, well, focus on the part you can control, which is, what are your activities to self-soothe and help yourself feel calmer?
That sounds good. So basically, it's kind of going back to that picture you showed about, focusing on the things that are in our control as opposed to the things that aren't.
Yes. And learning how to meet fear skillfully. So noticing, wow, I'm feeling fear right now. Where do I feel it in my body? What do I need right now in response to that fear? Can I be mindfully present and just with it? Can I give myself a self-soothing, self-compassionate type of phrase like soften, soothe, allow, or one of my mindful practices? And then noticing that I'm feeling afraid, what kind of tool can I pull out of my toolbox? Can I choose to call a friend? Can I choose to clean up my apartment? Can I choose to reach out to people? What can I do in response that I can control that helps me feel safe? And that is being with fear in a more skillful way, as opposed to fear prolonging leading to anxiety, which is the possibility of a threat, or worry, which are those worry thoughts that we have in response to being afraid. So if we can bring down the fear by just being with it skillfully, then we can learn to not have to even use any skills after that.
So in a way, you're saying people have the tendency to avoid fear and rather than kind of just being present with it.
Yeah.
And noticing, okay.
And there are skillful ways that we can be with fear, and it's actually doing nothing in a way. It's using a skill, but we're not running away from it. We're actually being with it, noticing that it rises, plateaus, and descends. And when we do that by giving ourselves some sort of mindful way of being with that fear, then we can change our relationship to fear. And it's something funny happens where when we're not afraid of fear anymore, we don't feel the need to engage in anxiety behaviors or worry thoughts. And our level of fear can actually come down.
Thank you so much for that. One more question. I feel worried when groceries come into the house that I have a higher risk of getting COVID even after disinfecting. What's a technique that I can use to stop this?
Sure. And so I would say that everyone has their own level of risk that they feel comfortable with. And so one approach would be to say, well, what is a problem-solving approach to reducing the likelihood of certain foods being contaminated? And so individuals can choose their own disinfecting procedures, whether it's anti kind of these wipes that people have, or they could choose to wash their food with soap and water, and then to remind themselves that after doing their particular practice, that they are as safe as they can be right now. And so I'd recommend having some sort of safety or disinfectant type of protocol where you say, okay, here's my problem-solving approach to this fear of contamination, and that's to choose washing, choose Clorox wipes, whatever you choose, and then to say, once I've committed to that plan, I am safe. So when you have that worried thought of, well, what if I'm now susceptible to COVID? I've eaten this broccoli. Well, you could also remind yourself, what if you're not? You've actually engaged in safety behavior.
Great. So just focusing again on kind of action planning, problem solving, and then you're kind of taking back control. Another question just came in, and it says, how can you deal with the fear of, job loss, especially around trade work in general, when you've never had to deal with this before?
Mm-hmm. So in a way, certain people are getting their first experience with anxiety, like this is what it's like to worry, whereas other people have worried in the past before. And we have these magical beliefs about worry that it'll somehow help our problem solving or prevent this outcome that we're not looking forward to. So no one wants to lose their job, but certainly worrying and saying, what if I lose my job? That doesn't make you less likely to have a job in the future. And so I would push back by saying, okay, let's start off with just awareness and disengagement. And so if you have a worry thought, you can just recognize it as a worry thought and come back to your regular thinking. And the other, if you want to attack it, would be to say, well, what are the odds of that occurring, and looking at the probabilities. And for a lot of people, the probabilities of them losing their jobs has increased. But in response to that, I'd say we're all in that together. And so everyone except essential workers right now is experiencing differences in how they're being used and how they're being paid. And we are in a common boat together. And just because you're feeling that way, it doesn't mean you're alone, and it doesn't mean something bad is going to happen. And so you will be able to also cope with different changes. So if you were to find a job and then not have a job, if you were to lose your job, those are all things that we can cope with, not easily, but we can cope with them. And one helpful reminder about worrying is, even though it distracts us from the fear of losing our job, it doesn't make it more or less likely that we will lose our job. So you could say, well, what's a problem-solving approach? Well, could now be a good time to look at online courses in order to strengthen your vocational training. Could now be a good time to reach out to contacts and say, after this COVID business, do you have any possibilities for me? and educating yourself about what to do in the event of loss of job. And so that would be my recommendation for skillfully approaching it, and then adding some sort of problem solving activity.
Okay. Okay. So there's strengthening numbers and sometimes just normalizing the experience that other
Yeah.
people are also experiencing that can also help. So, so one more question: what advice do you have for parents in terms of how they can assist their children to meet fear skillfully and to reduce their anxiety? And I guess it's also tied with another question about how can you help it if it's you're not the one who's anxious, but your loved one is really struggling. How can you help them?
Yeah. So I think what's really helpful is that of acknowledging the fear and saying to the child, you're afraid and I'm afraid too, but not becoming dysregulated because you're afraid. So it's okay to be afraid. And we can model skillfully being with fear by saying, yes, I'm afraid. And this fear might get a little stronger, but then it'll also go down. And one way I can be brave in the face of fear is by confronting it and being with that fear and noticing that it will descend and I can act skillfully. And so noticing that the child is afraid or you're afraid, you can ask yourself, what kind of soothing activities can I give myself? Because when we're afraid, it's a sign we need safety or comfort. And so skillful activities could be soothing activities like reassurance type activities, activities with a lot of mastery and control, like puzzles or games, and reminding ourselves that it's okay to be afraid and we can do things to help us feel less afraid.
Okay, so just you know, one of the things you mentioned was modeling. If you kind of demonstrate what it is like to manage it, and to validating their experience, right? Okay, so that can go for a child or other loved one, for sure, if they're experiencing that. So not invalidating as if it's like, why are you afraid? But really just acknowledging it and validating it. Okay, so what does one do if you always get nauseous when you hear about the COVID?
Yeah. And so that tells me that somewhere before you got nauseous, there's some sort of fear in response to it. And so I would say, what's the first thing you can notice when you're feeling afraid? And maybe you start to feel some sort of uneasiness or queasiness. And you could say to yourself, okay, fear is here. I'm hearing about this COVID, and what can I do that's skillful in this moment? Can I label that fear, and can I give myself something soothing? And so an example of soothing activity could be self-talk, a mindfulness practice, something comforting. And then after you've done that, you can select some sort of activity that helps you feel balanced. And then asking ourselves, what can I control and what I can't control? And so perhaps you're consuming a lot of media and that's making you feel fearful. And so I would encourage someone to consider their sources of media and the amount of media that they're exposing themselves to as a way of working backwards in order to try to not be confronted with fear messages as prominently as they were before. And so the news is quite sensational and it's quite emotionally charged right now. And I encourage people to balance that with good news or things that help them feel soothed, such as good news stories or stories of comfort or stories that are just completely unrelated to what's happening in the world right now, such as novels or other sources of information.
Okay, sounds good. Thanks so much for that answer. We have just a couple more questions. What can I do if I am trying to manage my anxiety by not, you know, talking about COVID all the time, but people at my house or those I live with won't turn off the news and won't stop talking about it?
Mm-hmm. So that's a wonderful challenge of both the things you can control and the things you cannot control. And so you can't control other members of your family, but what you can do is share with them how that experience is impacting you. And so you could ask them to do something in a more respectful way. So if you share the television, then maybe you can take turns. But another thing you could do is remove yourself from that situation as best as you can to say, I know when I'm around COVID media, that if I consume more than a small amount, it'll actually increase my fear. And so we know that if we expose ourselves to a lot of fear, we will start to feel more afraid because it doesn't give us a chance to cope with that fear, to process it, and act skillfully with ourselves. So one thing we can control is the amount of media that we're exposed to and the type of media we're exposed to.
That sounds really good. You know, I guess, could, wear a headphone, go to another room, things like that, just to, if they don't want to change, because you can only control your own behavior, right? As you were rightly
And it takes a
saying.
while to change our relationship with fear because for many of us, our response to fear is one of when we touch something hot or something that's always scared us and we always turn away. And so I view it as a challenge of relearning our relationship to fear, which is, of course, if a tiger is chasing after you, then you do need to acknowledge that that fear is there. But for the most part, there aren't tigers chasing after us. And these are ideas that are scaring us. And one thing we can do to be with the fear in a different way, acknowledge that it's there, allow the fear to be there, notice that it'll rise, plateau, and descend, and be with it skillfully.
Mm-hmm. Thanks so much. There's a lot of questions. I'm just trying to group them and get through as much as we can before our time is up. One says how, and I guess these two can kind of go together. How do you cope with being in your house so much more than usual with all the family there not working and getting on each other's case, I guess? And I guess the other one is, well, yeah, just take that and we'll go from there. So this one is more family around. We're not used to it. How can I manage that?
Yeah. And so this type of physical distancing is much harder on extroverted people or people who enjoy the presence of others than introverts who want to be left to their own devices and read their books and do their introverted activities. But we're also in very close comfort with people, and that contact has increased to the point where it's perhaps beyond our normal level of comfort. And so I think we all need timeouts. And so one way to try to manage that is carving out times where you say, instead of going to the gym or leaving the house as a timeout, making a timeout time. So from saying from 8 till 10, I'm going to be watching a movie on Netflix and please don't disturb me. Or this is my reading time from 7 till 9, and that's my chance to just recharge. And so I think if we communicate to other members of our family to say, just because I'm in the house, it doesn't mean I'm available for contact 24/7, then we're just shaping our expectations slightly differently to say, that's okay that you want to reach out to me, but I need certain times where it's just for me.
Mm-hmm. That's great. I actually spoke to a couple this week, and that's exactly what they were doing. And it seemed to be working well. You, instead of taking the walk together, you go for your walk, so I have some me time. Then I go. When this door is closed, I'm having some me time. You do something else.
Yeah.
Which is great, so that you're not literally in each other's faces all
And
the time.
sometimes couples tend to break that rule, and I've joked around about creating kind of like a Google Calendar where you say, okay, if you want to meet with me, you have to schedule a meeting because I'm not available all day to talk about everything you want to. So from 4 to 5, we can do a one-on-one session where we'll talk about what you want to, but from 5 till 8 or from 7 till 9, I need to work on my work, and that's not the time I can be disturbed.
Mm-hmm. So on the flip side, and I'm watching our time, on the flip side of that, here's someone asking, I'm struggling to manage being alone. My depression seems to be getting worse because I cannot connect with family and friends face to face. How do I manage that?
Yeah, and so the first thing to acknowledge is what the feeling is in there, and it's of sadness and loneliness. And if we can be kind to ourselves that we're feeling that way, we can say, gosh, I'm sorry you're feeling sad and lonely. What do I need that's skillful? And I'd recommend something soothing and something activating. And so something activating could be reaching out and using video technology. We live in a wonderful time for seeing people's faces with things like FaceTime and Skype. Another possibility could be to throw some sort of virtual party where you're sharing kind of time together, even if you're watching a movie together or going to a virtual gallery together. So using these video technologies to create the types of experiences that you had. And if you feel comfortable sharing with people that you are feeling sad and lonely, and and asking them for that support that could be beneficial.
Okay, and I think I'm going to end with this one, and I guess it kind of ties two in. My grandmother is 90 and in a nursing home. I'm scared she will get COVID since she has dementia. And that's one side. And then the other side is, you know, I'm fearful for my children who are still taking public transit and I can't see them, adult children. What can I do? That's not on me, but I'm worried about someone else.
Yeah. And so it also gets into the realm of what's a reasonable risk and what's an unreasonable risk, and what can I control and what I can't control. And for visiting someone who's in their 90s at a nursing home, I would say a reasonable approach would be to not visit them in person. And I know someone who's 90 with dementia might have trouble communicating, and it might be really comforting for them to see you and just spend time with you and just touch them. But I'd say right now we're kind of doing a compromise between safety and what people need, and a reasonable safety precaution could be limiting your contact with your 90-year-old grandmother. And in terms of when other people are engaging in activities like using the TTC, I think one thing to ask ourselves is what level of risk can we tolerate? And if the answer is they're using their TTC to be an essential worker and they don't have another choice, then we can say, well, the risks of them helping other people versus the risks of them getting sick, can I do some sort of ethical type of negotiation where I feel okay with certain risks, but I don't feel okay with other risks, such as if they're going to a party or if they're going to meet a group of friends. And so the TTC is still safe as long as we're practicing physical distancing with the TTC. And if someone's using it properly, such as an essential worker who needs to travel, or you're doing that infrequent grocery trip, I still think that's responsible use of the TTC. And we have to accept a certain amount of risk if that's not possible.
Mm-hmm. Thank you so much, Dr. Gold. That's as much as we can take in terms of questions for today, but I just want to encourage people, if they have other questions, to just send them to us at Epilepsy Toronto. Mackenzie will put our email there where you can reach us, or if you're from another area of the city, you can reach out to your closest epilepsy association, just to ask them those questions. But in addition, Mackenzie will be posting some of the links that Dr. Gold made reference to earlier, just online resources that you can use during this time to manage not just anxiety, but also depression. You can also feel free to reach out to one of us at Epilepsy Toronto. We have some of these resources, including that thought record that Dr. Gold quoted. We can send it to you. I know some people are asking for that. We can definitely send that to you. And remember too, if you missed anything from this presentation, we'll be posting the feed on our YouTube channel, Epilepsy Toronto, as well as on this very same Facebook page. So you can go over it and watch and remind yourself of some of the strategies that were shared today. Also, we want to let you know that we will be having more of these live webinars. So please stay tuned. Keep on our social media or on our website so you know when the next one is coming up. Also, we have a couple of other initiatives that we're doing just to keep you engaged, which one of them is Mindful Mondays, where we're doing just some mindfulness, light yoga, relaxation strategies, which are also very helpful, as Dr. Gold said, for managing anxiety. So send us an email so we can send you the link how to sign up for that. And to your point, Dr. Gold, you were talking about just balancing the negative news with positive news. So another thing that we will be rolling out is what we call Feel Good Fridays, where we'll be just sharing videos of positive things that are going on that can help to balance out all the negative things that we're hearing on the news. So again, thank you, Dr. Gold. This was really very good. And thanks to everyone who was able to join us today. And from us at Epilepsy Toronto to you, we just remind you, be safe, be well, and please stay home. Take care, and thanks again for joining us.